Prime Minister Silveria Jacobs, Madame le Préfet SYLVIE FEUCHER, President of the Collectivité Daniel Gibbs, First Vice President of the Collectivité Madame Valérie Damaso, ESF 5 Coordinator and Chief of Police Chief Carl John, Commandant Stéphane Basso, Commander of the Gendarmerie French St. Martin, ESF 6 Coordinator and Head of Public Health Fenna Arnell, Ava Lista de Weaver, Head of Collective Prevention Services, members of the media, ladies and gentlemen, good afternoon. I'm Relaika Roach of the Department of Communication, and on behalf of the Prime Minister of St. Martin, the Honorable Silveria Jacobs, I welcome you to this joint press conference with regards to the state of emergency lockdown. For more on this subject, I would like to invite the Prime Minister of St. Martin, the Honorable Silveria Jacobs, to address you.
People of St. Martin, I come to you this afternoon as Prime Minister and Chair of the EOC in a press conference for today, April 5th, Palm Sunday, marking the start of the Holy Week. I wish all who are celebrating this week to do so in somber remembrance of what this time historically has meant, as well as the time that we are going through today. On Saturday, April 4th, 2020, in a press conference, I declared a state of emergency for St. Martin, effective today, April 5th, 2020, as of 12 a.m. This means that no one is allowed to roam or drive on the roads for the next 2 weeks. The only persons allowed to move are those with disaster passes or those with written permission from myself in my capacity as Prime Minister and Chair of the EOC, or Chief of Police Carl John. That is for the Dutch side. Of course, that counts also on the French side for Madame la Préfet SYLVIE FEUCHER. The first point I'd like to make is that, as per the addendum in the decree, those who are exempted, so those who are allowed to move, I mentioned already, but I would like to add that the GB technical staff and workers, as well as workers of the harbor and airport, are also allowed to move during this time. Also able to operate in case of emergencies are supermarkets and bakeries. Those are catering to the hospital, prison, and for government operations related to COVID-19 to be able to facilitate deliveries. Gas stations, too, will be open for emergency vehicles, as well as all of the persons mentioned before. Related to the disaster pass and waiver requests, for persons who must travel along the roads, this is also crossing the border, special arrangements to use the public road must be sent via the required waiver form, which is then approved by our Chief Carl John. The request for this approval is to be sent to pr@policesxm.sx. Let me repeat, pr@policesxm.sx. The approval will then be emailed back to you. This is needed for persons who, for a demonstrable urgent reason, so who have a serious urgent reason, which could be medical or otherwise, and need to travel, to be filled in. Do not wait until the last moment. Download the form, fill it in, and send it via email to Police Chief John, or fill it in online, as it is now available online, and forward. When you submit, it will go directly to Chief John, who will then respond via email to you. So that is for also persons who are in charge of elderly or family that require them to move for urgent reasons. Essential staff of the businesses mentioned above should be in possession of either a valid disaster pass, and that includes medical personnel, and in absence of that pass, the manager or the entity may request via the waiver from Chief John the permission to be able to move. I remind that this is pr@policesxm.sx.
Thank you, Prime Minister. At this time, I would like to invite Madame la Préfet SYLVIE FEUCHER, who is joining us via Skype live stream, to provide you with her remarks.
Mesdames et messieurs, bonjour. Bonjour à la population de Saint-Martin et de Sint-Martin.
Ladies and gentlemen, good morning and good day to the population of St. Martin and Saint-Martin.
Le gouvernement néerlandais, Madame la Première ministre, m'a tenu informée des nouvelles mesures qui sont actuellement en vigueur et du décret relatif à l'état d'urgence.
The Prime Minister of St. Martin informed me of the new measures that will be enforced, as well as the decree that enables these new measures.
Nous respectons les décisions de la partie néerlandaise qui sont des décisions de souveraineté.
We respect the decisions that have been taken by the Dutch side, which are sovereign measures.
Et nous allons, nous aussi, nous adapter pour que des deux côtés de l'île, nous puissions être en sécurité.
And we'll also adjust we'll also adjust so that on both sides of the island we can be secured.
Nous poursuivons côté français les mesures que nous avons mises en place depuis 3 semaines.
So we'll continue the measures that have been taken on the French side over the past 3 weeks.
Et notamment l'obligation pour toutes les personnes qui se déplacent d'avoir un document qui justifie le déplacement.
The persons that need to move around, they will continue to need the document allowing them to move around.
S'agissant de la traversée de la frontière, nous avons mis en place un nouvel imprimé que je délivrerai personnellement, c'est la préfecture qui le délivrera, de manière à ce que nous ne laissions passer que les personnes qui sont dûment autorisées.
With regards to crossing the border, a document has been prepared by the prefecture. That document will be delivered personally by the prefect and will allow persons on the French side to cross the border.
Nous avons des effectifs de gendarmerie et des effectifs de la police néerlandaise qui vont tenir 24 heures sur 24 les 2 points de frontière de Belle-Plaine et de Bellevue.
So there will be a contingent of police from the Saint Martin, that side, and of the gendarmes from the French side of Saint Martin that will be at the 2 border points, which will be Bellevue and Belle-Plaine. These borders will be controlled 24 hours per day.
Nos services de police coopèrent depuis, comme ils le font tout le temps, mais ils coopèrent encore plus depuis le début de cette crise sanitaire.
Our police forces have been cooperating for a long time, and they will maintain that cooperation as they have done during this crisis.
Les effectifs de la KPSM et les effectifs de la gendarmerie sont ce qu'ils sont et les missions de sécurisation en dehors de la frontière restent les mêmes.
So the officers of the KPSM and those of the gendarmerie are what they are, and they need to maintain not only these missions on the border but also their usual missions as they are carried out.
C'est la raison pour laquelle nous avons, en accord avec la Première ministre, souhaité ensemble, et parce que les mesures du gouvernement néerlandais ont été renforcées, et pour prévenir toutes les difficultés, décider de ne laisser ouvert que 2 points frontières, Belle-Plaine et Bellevue.
And it's because of this limited staffing that we have decided to conform with the measures that were taken by the government on Saint Martin, and to prevent any difficulties, to maintain only 2 border points opened.
Toutes ces mesures sont prises pour protéger ensemble la population de Saint-Martin et de Sint-Maarten, car je sais que nous sommes tous attachés au slogan « Une île, un peuple ».
All these measures were taken to maintain the safety of the population, because I realize that we are all very attached to the one island, one people motto.
Time I would like to invite President Daniel Gibbs, who will also be joining us via a telephone call to provide his remarks.
Monsieur le Président.
Oui. Dear St. Martiners, good afternoon. This is the President of the French side. As Madame la Préfète said, we took note of Madame the Prime Minister decision on Friday considering the shutdown of the Dutch side, and we respect that decision. Due to that declaration, things happened between the Prefect, myself, and also the Prime Minister. Those meetings were held in different areas to organize also ourselves on the French side in terms of circulation and security control. Because of cooperation needs that needs to prevail, and knowing that we are in exceptional crisis situation, our population of both sides are not accustomed to live in these circumstances. My concern was mostly for the cross-border workers, the survival of each one due to the shutdown of grocery stores. I leave to each side and their due competences the way to deal with those security matters. I will not go over the measures taken by certainly Madame la Préfète. They are taking in their due responsibilities and competences, and we as collectivité will do our utmost to maintain this collaboration, this cooperation between both sides. And as Madame la Préfète mentioned, the word that needs to prevail is one island, one people, and for the best interests of each and all of us. Thank you.
Thank you, President Gibbs. At this time, I would like to invite the Chief of Corps Police St. Martin, Chief Carl John, to provide his remarks. Chief John.
Thank you, Rolaika. As just mentioned by Madame le Préfet and President Daniel from the French side, indeed we will be limiting movement between the two sides at the borders at French at Belvedere and at Bellevue. So the other two parts will be physically closed. Those movements are only for essential and emergency. This morning already, we received nearly 100 requests for movement on that side of St. Martin. I want to emphasize that it's not business as usual. The permission to move is only granted for essential and emergencies. We should try to adhere to this as much as possible.
Thank you, Chief John. At this time, I would like to invite Commandant Basso, who is also joining us via Vimeo livestream, to provide his remarks.
Bonjour à toutes et à tous.
Good day to everyone.
Donc, je souhaitais préciser ici que nous avons mis un dispositif en place en partenariat avec la KPSM.
So I wanted to specify here that the system that we put in place was done in cooperation with KPSM.
Pour renforcer d'une part les contrôles à la frontière qui nous sont demandés.
In order to strengthen the controls at the border.
Mais également sur la partie de Saint-Martin pour renforcer les contrôles des mesures de restriction de circulation qui sont en place depuis déjà le 17 mars.
But also on the French side to strengthen the measures of control that have been enforced since the 17th of March.
À ce titre, je demande officiellement à l'ensemble de la population de bien respecter les consignes de confinement.
And for that reason, I ask the population to meet or to conform with the self-isolation measures that are in force.
Nous constatons depuis quelques jours un relâchement de la part de la population et nous serons là pour évidemment verbaliser l'ensemble des personnes qui ne respectent pas ces mesures-là.
Over the last few days, we've realized that some people might be lapsing on their obligation, and we will be present to fine those that will be on the road for no specific reasons.
Pour réaliser l'ensemble des missions qui me seront confiées, nous avons depuis hier un renfort de 16 gendarmes qui sont arrivés de Guadeloupe.
In order to meet our obligations, we have an extra members of the force composed of 16 gendarmes that arrived yesterday.
Et bien sûr, nous multiplierons désormais les contrôles à la fois sur la partie française et, comme je l'ai dit, en lien avec la KPSM sur les deux points de frontière qui restent ouverts pour les 15 jours à venir.
And as I said previously, we will strengthen our controls on the French side of the island, but also at the border in cooperation with the KPSM.
Merci de la compréhension de tous.
Thank you for understanding.
Thank you, Commandant Basso. At this time, I would like to re-invite the Prime Minister, Silveria Jacobs.
Thank you, Relaika. Thank you, Madame la Préfète, Commandant Basso, Chief John, as we continue to collaborate together on two sides to be able to say that we are truly one island, one people, one destiny. The Treaty of Concordia will not be in vain. Persons already, even to come to this press conference, had to go through a very strict measure at the borders. Some of our workers here with DCOM also reside on the French side, and similarly, the reporters that were going to the French side, some live on the Dutch side. So we continue to work with the challenges that we are faced. As I said before, the permissions for essential movement is there as long as you hold a valid disaster pass, and in absence of that pass, a signed document, as Madame la Préfète showed just now, as well as the one that we already have on our website, Form 3, that is for movement across the border. That one just has to be sent and submitted to Chief John for his signature, and that would give you the agreement to move for essential services. So we would like this to continue. As I said yesterday, on April 4th, we will assess within the week to see how this is going, and of course, ensuring that food security remains our top priority for our people on St. Martin. There is no need for anyone to go out of their way to do anything extra to get food. We have two email addresses. One is for persons who have lost their jobs, but specific for now, food is important. The social assistance form, social assessment form, which is uploaded on government webpage, will be filled in, can be filled in, and once it's submitted, social services will know that you are a person that requires food, and food will be delivered to you. We're already working on the first group, and we'll be assessing during this week who are the other persons who require food to be delivered to them. I'm also holding a meeting tomorrow with the supermarkets and the food suppliers to ensure that food can be delivered as ordered as well. At this time, I'd like to allow for the press to ask questions, as this press conference, once we have finalized this part, will continue on the health part, at least for the Dutch side of St. Martin. But I would like the French who are there with their press to be able to ask the necessary questions.
Thank you, Prime Minister. As Prime Minister mentioned, we will be taking questions for the French side. We have two questions, one from Bibi Shaw of SMN News, geared to Madame la Préfète FEUCHER, and as well as the Prime Minister. Prime Minister from Bibi Shaw of SMN News, will the media from both sides of the island have free access to both sides?
Yes, the media, once they have a pass and have gotten permission from their respective sides, they will be able to travel to the other side as necessary for emergencies or to cover stories. The media is on our list. Media outlets are on our list, and therefore those persons should have a disaster pass or a signed waiver from our police chief.
This question is for both Madame la Préfète SYLVIE FEUCHER as well as the President of the Collectivité, Mr. Daniel Gibbs. Is the French side delivering essential items to the elderly and vulnerable?
Can you hear?
Yes, I can hear.
Two of us. 1 minute. There was a question for two of us. Can you repeat it, please?
Is the French side delivering essential items to the elderly and vulnerable?
The question that was asked was whether both of us are delivering essential items, food to the vulnerable. But I believe that yes. Madame la Préfète.
Ah oui. Monsieur le Président, vous voulez répondre pour la collectivité, pour l'aspect livraison de repas, ou vous voulez que je le fasse?
Je n'ai pas entendu la question.
La question, c'est est-ce qu'il y a la même chose côté français, la livraison de repas et la livraison de denrées pour les personnes qui en ont besoin? Vous pouvez dire oui.
Oui, non, mais...
Vous dites en anglais, comme ça, vous répondez je pense que c'est mieux que vous répondiez vous.
En anglais ou en français?
En anglais.
Yes, to answer that question, yes, the French side is organized since the beginning. We have an organization in place so that we can have access to persons that are in need to be able to deliver plates. Our canteen, which is called the CETOS, is organizing food delivery to all persons vulnerable, all persons in needs of on our daily basis. That kind of delivery. We have a number that is giving all through the week for that service to have access to, in order to respond to all those persons that are in need, or person who knows someone who is in need.
Yes.
That is social. That is the social district of the collectivité who's handling that part. Of course, we are working also with association who give their services also to the collectivité to help and provide that distribution.
Yes, thank you, Mr. Gibbs. And similarly, as I mentioned before, with the community development, community councils, K1, Red Cross, and other entities, including individuals who have been assisting all along in getting food to the needy, are already working on distributing food for the needy and the vulnerable.
Thank you, Prime Minister and President Gibbs. At this time, we would like to allow the French counterparts to provide their questions to the Prime Minister.
The French side. Questions from the French side.
Comment quelqu'un qui habite en partie hollandaise et qui doit aller en partie française fait pour récupérer le laissez-passer dont vous parliez, Madame la Préfète?
Elle l'a dit. Oui.
The question from the French side: how can somebody who lives on the Dutch side and wants to come to the French side get a pass?
And vice versa.
Yes. For us, I have already expressed that there is send an email with the pass to pr@policesxm.sx, pr@policesxm.sx. This can go directly from our personal waiver on the site, if it is a personal, or that would be Form 3 if they have to cross the border. If they fill that in online and submit, it will go directly to the police chief, who will sign off and email it back to you. So ensure that your email address is on that form. He has already handled over 100 for today, and since I've had him here waiting on a press conference, I guess there's a stack awaiting his signature, but that is how we will deal with it on Dutch St. Martin. So they fill in the form, send it to Chief John, he signs it, sends it back.
Pour la partie française, nous allons mettre un post tout à l'heure et nous utiliser la boîte Covid-19 que nous avons déjà activée pour d'autres raisons. On fait un post juste après la conférence de presse, mais je rappelle, c'est moi qui délivrerai les attestations et qui les signerai à l'entête de la préfecture. Mais je le rappelle, nous respecterons strictement la demande de la partie néerlandaise. Ce sont des demandes pour des services d'urgence pour rentrer dans le cadre qui nous a été spécifié.
After the press conference on the French side, they will activate a COVID-19 box that has been used previously. However, the prefect will deliver personally and will sign personally any authorizations authorizing someone to cross the border. These authorizations will meet the requirements that have been specified by the Dutch side, by St. Martin Dutch side.
You have another question, Madame la Préfète, from your side before we end? Two more questions.
Est-ce que vous avez une question? Non? Igor? No? No, that's all.
That's
no more
it?
question.
I would just like to reiterate that together we are collaborating. We are not closing the border. We are actually protecting our citizens from the spread of this pandemic, COVID-19. As such, already through this week, with our curfew of Monday, we have been monitoring crossings, we have been monitoring movement, but now with the total shutdown, you have to just ensure that you have your travel waiver, whether it is for professional or urgent reasons, signed by, if on the French side, by La Préfète, or on the Dutch side, either by myself or Mr. Carl John. So all essential services must have that document with them or a disaster pass. And the two borders that have minimal use, which are Oyster Pond and Kupakoi, those will be physically closed so that our services can concentrate on the two that has the most traffic, which is Bellevue, Colbay, and French Quarter, Dutch Quarter. We expect that the people of St. Martin will not make this a negative. We are actually allowing movement, but it is restricted due to the pandemic, not for any other reason. It is because on both sides, we are seeing a large rise in numbers, and we have to, in this shutdown period, do our best to contain it. This is the only way we have seen around the world that we can contain the spread of the disease. And so I thank each and every citizen of Swaliga, of Uwalichi, of One Island, St. Martin, St. Martin, whatever you want to call it. We have to do this together, and we're doing this for the protection of our people. Yes. Thank you, Madame La Préfète. We will continue now with the rest of our press conference, but I thank you for contributing and for us to do this together, as it is important for people to see that we can collaborate when it comes to public safety and health on St. Martin.
Thank you, Prime.
Thank you. Thank you, Prime Minister.
Thank you, Mr. Gibbs, Daniel Gibbs, President, and your entire council.
Thank you very much.
I would once again like to thank Madame la Préfète, Sylvie FEUCHER, President Daniel Gibbs, as well as Commandant Basso for joining us. At this time, I would like to invite Mrs. Ava Lister de Weaver, Head of Collective Prevention Services, to provide her remarks.
Good afternoon, everyone. So apologies in advance. This message from me may seem a bit long-winded, but I wanted to shed some light just on the process that CPS is currently undertaking for when we receive calls from the community or from physicians who are reporting suspected cases of COVID. So I know over the past couple of weeks, people have been asking for some clarity around, our process and our protocols and what we do. So I just wanted to shed some information on that. So as a reminder, voluntary quarantine was implemented about 3 weeks ago. And those returning residents were provided with a form and were also told to report to CPS. So from that list, CPS has tried to make contacts with those persons over the 14-day period to assess whether they've developed any signs or symptoms. And our initial protocol, we wanted to check in on persons at day 2, day 7, and day 14. But due to the sheer volume of persons in quarantine, adjustments had to be made to ensure that follow-up was done at least twice within the 14-day period. So persons should be or should have been in contact by telephone by the surveillance team at CPS, where we would assess if over the 14-day period you've actually developed any signs or symptoms. And if over the course of the 14-day period you do develop signs and symptoms, what I would ask is that you call your physician or call 914 to indicate that you are in quarantine and you've developed signs and symptoms. Another thing that I would like to ask the public is, because we've dealt with over 500 cases of persons in quarantine, is that if you are still showing no signs and symptoms and you are close to your quarantine end date, that you reach out to us and call 914. Our team is doing our best to make sure that we are monitoring those persons that have taken this voluntary quarantine. But we also want to ask again for your patience and understanding, because the situation changes almost daily. There's also been questions around whether spot checks are in place for those persons who are in quarantine. And I can assure you that this has been done over the course of the last 3 weeks. We've depended on persons calling out who have recognized somebody who had just recently returned, or that knows of somebody that should be in quarantine or in isolation and not adhering. And we've done our due diligence to ensure that we followed up to make sure that the person really understands what it means to be in quarantine or in isolation. Another area that I would want to address today is what we mean by persons in isolation. So, and another question that we've been getting lately is, how does CPS determine who gets tested? And so persons in isolation right now are those that are exhibiting signs and symptoms that indicate suspicion of COVID-19 infection. So in the beginning of the epidemic, CPS was using WHO protocol and case definitions, which included, among other things, recent travel, exposure to a known COVID case. However, seeing that now we have more cases in the community, we have loosened our case definition a bit to include those reports that are coming in from GPs where they've said, you know, my patient hasn't traveled recently, but they may have been in contact with someone who had flu-like symptoms. So we're also trying our best to gather that information from the GP or persons that call to report themselves to 914. So when that information is gathered at CPS, someone from the surveillance team will notify you, whether it's a nurse or any other members working at CPS. And what we will gather is information including, you know, when did you start feeling sick? When are your signs and symptoms? Whether you have underlying condition, find out who your house doctor is. And then we will sort of triage from there to see when we could accommodate testing. When the nurses do come to someone's home, I just wanted to provide some light on that process as well. They will be wearing full PPE. So that means, you know, they'll be wearing an outfit, a gown, mask, gloves, goggles, and a sample will be taken, a nasopharyngeal, so a swab in the nose, will be taken for persons that are displaying signs and symptoms. Another thing that we've, been asked quite a bit is if I am in a household with someone that has signs and symptoms, you know, can I be tested as well? Or when results come back and the person in the household is positive, can I automatically be tested? And I think what's important here is that currently we are only testing those persons in the household that are defined as close contact. So, you know, being with that person for a prolonged period of time, we are only testing those persons who develop signs and symptoms. And while I know it is a bit frustrating and stressful to know that you are in a household with someone who is potentially a suspect or confirmed COVID, these are the measures that we're adhering to for now. So if you are, you know, still healthy and caring for a COVID positive patient, there are certain measures that you can take. So of course, hand washing frequently, using ABHR, wearing your mask and gloves, making sure that the person who is potentially infectious or sick with COVID-19 wear a mask, which is something that our nurses should be or will be handing out to those persons who are COVID positive. Making sure that you don't share your household items. So don't share, you know, drinking glasses, utensils. Make sure you're in a well-ventilated area. Making sure that you're cleaning thoroughly, that you're washing laundry thoroughly. These are some of the steps that when the nurses do come by, that they should be explaining to you and your household. So from a data perspective, I wanted to just shift gears a little bit. And as you know, everyone can see that our numbers are increasing exponentially as we get them every day. And the reality is that cases are only going to grow. And the main factor of how to halt that spread is to stay at home. I can't stress enough the seriousness of adhering to quarantine, adhering to isolation measures, making sure that you try your best to stay at home, because that is the way that St. Martin will overcome this, and it's the same measure being applied across the world. So what we're saying is not anything out of the ordinary. It's what's being implemented in every country in the world. Of course, people are anxious, and I completely understand that. And what I will stress is the importance of just taking these measures and taking the lockdown seriously. You know, we've also gotten a lot of questions about, you know, can we increase testing? What are we doing to, you know, for our testing strategy? And what I can say is that today we are in talks with our Caribbean partners with partners on the ground, such as Red Cross, looking at a way for us to tackle our testing and surveillance strategy. As I mentioned earlier, things are constantly changing. It's extremely fluid. You know, as data comes back, as guidance documents evolve almost hourly from various health organizations, we're making sure that we are using the data to make informed decisions for a strategy that is effective and efficient and one that works given our limited resources, both human and financial resources, and making sure that we address those vulnerable groups and those vulnerable clusters that we are seeing in our data appropriately. Again, you know, I would reiterate the fact that if persons have questions and they have concerns, that they call 914. And if, you know, they do have any health-related questions, to call their physician. Don't show up to the physician's office. Don't show up to SMMC unless you call ahead first. And I can't reiterate enough that we can overcome this as long as we adhere and are disciplined to the 2-week stay-at-home period. Thanks.
Thank you, Mrs. Ava Lister de Weaver. At this time, I would like to invite ESF 6 Coordinator and Head of Public Health, Ms. Fenna Arnell.
Good afternoon. My update is going to be on Sorry. Good afternoon. My update is going to be focused on 3 specific areas, which is the dedicated isolation area, the expansion of the St. Martin Medical Services, St. Martin Medical Center services, as well as the changes in access to your GPs and pharmacies. So thus far, we have found and deemed a dedicated isolation area that is first of all aimed towards providing isolation for persons who are unable to isolate due to their living circumstances. So persons who live in households with a large number of persons but are unable to separate themselves from each other, from the rest of the household, as well as persons who are not adhering to the isolation guidelines. That will be the so-called mandated isolation. As it pertains to the St. Martin Medical Center, the pavilion, the pavilion has been erected, and during the course of the week, we will be able to give a better update on when the pavilion will be operational, but the main construction works are expected to be ready by the end of this week. As it relates to access to your GPs, the GP clinics can only receive emergency visits from their patients. However, GPs and their staff are waivered in order to provide telephone consultation to their clients. This is also the same for the pharmacies. The pharmacies will have will update their schedules, and that'll be available on DCOM for their opening hours. And some pharmacies will be providing delivery to their clients, but on DCOM you would be able to receive that information. That's it.
Thank you, Ms. Arnell. As we are practicing social distancing, the members of the media have made their questions available via WhatsApp. We now move to the question and answer session. The first question is from Ms. Judy Fitzpatrick of the Daily Herald to the Prime Minister. Is exercising on public roads such as walking, cycling, jogging, walking pets allowed or banned during the lockdown?
Thank you, Elika. As many who have read the decree by now would realize, the total lockdown does not allow for persons to leave their homes unless it is an emergency. Of all the things that you've mentioned in that long list, only walking the dog, where it is not possible for you to have your pet do its duties in your yard, will that be allowed. So no jogging, no running, no walking. All exercise must take place now within the confines of your home or within your yard. We are not allowing any congregating whatsoever, so this is just taking it up another level, whereby before you're allowed to go out individually to walk, jog, and walk your dogs, the only thing that you're allowed to do, if nothing better can be done, is to be able to walk your pets.
Thank you, Prime Minister. Another question from Ms. Judy Fitzpatrick of the Daily Herald. GB has indicated that it will not be disconnecting customers for some time. What arrangements have been made to ensure that the internet service providers such as UTS and Telem are also doing the same and not disconnecting their clientele as well?
Well, as these form all government-related services, we have had discussions. All of these entities are part of the EOC, represented by ESF 2 BTP, and therefore those regulations are in place that as long as we remain shut down, nobody will be cut off from essential services. We consider essential services at this moment electricity, internet service, telephone service. So anyone with outstanding bills will be able to do so online if they have that accessibility to pay their bill, and those that do not have the access online to pay bills, then they will have to hold on, and GB as well as the others are being lenient where that is concerned.
Another question from Ms. Judy Fitzpatrick. Prime Minister, you indicated last week that St. Martin does not have testing kits available. What quantity do we currently have? What headway is being made in sourcing more? And what are the plans for amping up testing during the lockdown?
Thank you again, Judy. I think I've already reported since then that since Wednesday, the HCLS lab in collaboration with SLS is testing locally. There is a limited amount available on the island. However, we have actually received many requests for donations and specific to this part where testing is related, and we are processing that at a moment in terms of sourcing, because we know that this is a pandemic which affects the whole world, and though you may have funds now to purchase, we still have to be able to find the locations that are actually shipping them out. So as soon as we receive those, then we will step up the testing. But I would like to reiterate that this 2-week period, even though we were doing that over the past 2 weeks already, and we saw that with increased testing, you're going to see increased positives. You will notice that a higher percentage of our testing is also positive, because we are being very selective in who we test. Persons with symptoms, most of all, and who have traveled or been connected to someone else who has the virus. A lot, as Fenna mentioned, a lot of persons who are in the home without symptoms are desperate to be tested, but that is not a protocol being used, and especially with a limited amount of tests, we want to be able to ensure that we test the sick persons as a priority. And Fenna would like to add to that, so.
In reference to the testing kits, I would like to indicate, and something that I should have mentioned in my opening remarks that I didn't, is that today, well, the plane just landed, the Netherlands has supported us in providing expansion of care that can be provided by the St. Martin Medical Center. 6 intensive care units are being delivered at this moment, will be set up and be operational by tomorrow. This shipment not only came with the 6 units, it's also coming with COVID-19 specific medication, intensive care medication. It's also coming with testing materials, so the swabs, which Eva just indicated, our limitations also forced us to be very strict with our selection as to who will be selected. We're now getting an increase in the amount of swabs, as well as analytical validation equipment. So our testing kits, we are also receiving those, which will allow us to also test more. The intensive care unit is not only, it will come with ventilators, as well as intensive care beds. And during the course of this week, we will also be receiving additional human resources to support SMMC in manning these additional beds. As well, included in the shipment are also the needed personal protective equipment, the PPEs.
Thank you, Ms. Arnell. We now move on to the final question from Ms. Fitzpatrick of the Daily Herald. Prime Minister, what is government's current liquidity position? How much funds do we have at hand in government's coffers to tide us over until the necessary assistance is provided?
As we know, government liquidity has been an issue even before COVID-19 reared its head. The CFT cautioned against us going below our reserves of less than 2 months. When we went to the Netherlands, we had that reserve of about a month. And so as far as the coffers of government, we are okay for a month of not receiving the income that we expected, because I don't believe we've gone into the reserves as yet. So that would still give us a month, and we are processing the liquidity request with the Netherlands for the emergency, as well as the promised 2019 liquidity support, which once we get our parliament to handle the budget, it has come back from the Council of Advice, has been adjusted by the Ministry of Finance, and should move on now to the Parliament to be handled. And if they handle that in a quick succession, then we are able to access also the 50 plus million, or about 48 million that was accessible via the 2019 budget. So we do not see a current liquidity issue, because we know that the steps are in place to handle or ensure that we get the liquidity support that has been promised, which, even though it's a loan, it will serve us quite well in the interim. And then, of course, the request for funding related to our stimulus plan will be handled at a later date by the Netherlands. So at the moment, we are not facing any strong liquidity situations, as long as we get what is promised to us within short.
Thank you, Prime Minister. We now move on to Lyndon Brown from BCN TV. Prime Minister, if the numbers of coronavirus victims continue to rise, what will be the further steps to decrease the spread of COVID-19?
Thank you, Mr. Brown. I believe between Fen and myself, we talked about the steps being taken by CPS at the moment, together with our GPs. We are doing a stronger information sessions within the communities where we see the spread has gone very quickly. Most of the last outbreaks have come from two specific communities. So we are increasing education to that area, isolation of suspected and confirmed cases from that area, especially if they live too close to each other or too many persons in a home that are not able to isolate properly. And we mentioned testing more stringently. So between isolation, education, and testing, we believe that we will be able to contain the virus faster than if we had continued the movement that was still ongoing. So during this lockdown period, that will be increased in order to contain the virus.
Thank you, Prime Minister. Final question from Lyndon Brown. Will there be any aid given to persons who are mentally unstable due to the coronavirus pandemic?
Thank you for that question. Persons who are vulnerable and have been vulnerable even before the pandemic are being served. As I mentioned, ESF 7 has been in collaboration with all the foundations that assist the vulnerable and the needy, and so they have been taken up in the plans to assist with providing meals.
Ms. Arnell?
And in addition to that, the Mental Health Foundation is also actively providing that service to their clients.
Thank you, Ms. Arnell. We now move on to Bibi Shah of SMN News. Persons working on the harbor, do they need to obtain a special waiver?
I believe that question was already clarified during our discussions with our French counterparts, but everybody that falls within essential services, which a harbor and airport also falls in, if they do not have a disaster pass, then they will be required to have the waiver signed by Chief John.
Thank you, Prime Minister. Final question from Ms. Bibi Shah. Prime Minister, a security employee working for Sheriff Security spoke out about the non-payment of salaries. Employees of this company have been speaking out for years, but have not been getting satisfaction. Now that there is a crisis on the island, will government intervene for those employees who may not have food on their tables?
As I said before, the persons with a dispute with their employer should send an email to dismissal team, dismissalteam@stmartingov.org. This is a direct link. The numbers hopefully will be up on DCOM's website, on government's website by Monday, which is tomorrow, but up until now, only an email address is available for all disputes related to labor affairs. Specific to that case, I have also seen the video and I'm horrified at the statements being made there, but also at the threats being made. This can be seriously dangerous for the person making it as well. Government has also in place, as I mentioned, the feeding program, which is being carried out by ESF 7, and any person that requires assistance should fill in the assessment form that has been placed on government website by social services. That form can be uploaded right away, and then your name and address will be known as to what type of need you have, and if food is one of those things that are necessary, then that will be one time known, and you will be put on the list to receive assistance of food delivery. So there are two areas. One for the labor dismissal team at stmartingov.org. That's an email address where you inform officially, and the form that is online, which is the social assessment form, social impact assessment form as a result of COVID-19. Once you fill that in online and press submit, it will go directly to social services, who will then add you to the list of persons needing assistance where food is concerned. Directly. The rest of the information will be used moving forward in terms of the stimulus plan, but for right away, those who have not, for some strange reason, been paid at the end of March should come in direct and marking.
Recommendation.
I can't figure out what you're saying. Well, persons that would be directly qualified to receive assistance right away. Sorry, the Dutch word took over at a moment.
Thank you, Prime Minister. We now move over to Andrew Bishop of stmartinnews.com. Between Prime Minister and Chief of Police, now that The Hague has returned 3 prisoners, one of which is said to be Catherine Fortune, aka Coochie, who is serving a life sentence, how will the government prevent an uprising or outbreak from this happening in the prison?
Thank you for the question, but I don't think the information is accurate. I think we have to be very careful when we are asking questions and using specific names. So the name that was used is definitely not accurate.
Thank you, Chief John. We now move on to another question from Andrew Bishop. For the Prime Minister, will aid or financial support be provided to many of the illegal immigrants on the island?
Aid as a result of the COVID-19 outbreak is being disseminated to the needy, the vulnerable, and anyone who is now out of a job. So those persons, as I mentioned before, regardless of status, are expected to fill in the form, the social impact assessment form, so that we may have accurate numbers to be able to provide the necessary meals for such persons.
Thank you, Prime Minister. Final question from Mr. Andrew Bishop for Chief of Police. According to the Public Prosecutor's Office, domestic violence may be involved in a quarter of the households on St. Martin. Where can victims go if the situation at home gets out of hand?
Well, I want to advise, if the situation at home gets out of hand, start by calling 911. We have a specific department within the police force that will provide assistance to every victim of domestic violence. As you know, when it comes to domestic violence, it's not advisable either to give the location where where the person will be located.
Thank you, Chief John. We now move on to St. Martin Island time. Will the airport be operating for cargo flights, or are they only on standby? Yesterday, the airport staff was not mentioned as being part of those being allowed to be on the road during the lockdown. Can that be clarified if missed by St. Martin Island time?
Yes, I mentioned essential government services, which the harbor and airport fall under, and I did not specify. However, in today's press conference, I already mentioned that the airport and harbor are included, and their staff as well. So not only for emergency flights, but also we have evacuations, we have cargo flights. All cargo and shipping is allowed, and that was mentioned in yesterday's press briefing. So of course, the persons that have to execute such are allowed to be at work with a disaster pass or the professional waiver signed by Chief John, as mentioned before.
Prime Minister, the final question from Mr. Andrew Bishop. Can the government use all articles of the National Ordinance Emergency Situation or only those mentioned in the National Decree?
The National Decree is what is used to execute the disaster ordinance and the state of emergency as we are utilizing it. So the National Decree specifies exactly what we are able to do, and the addendum, the bijlage, specifies which businesses are allowed. Within the National Decree, it gives the Prime Minister, gives me the opportunity to adjust times, to adjust openings, as well as to make changes, as I mentioned, that we would be doing in the course of the week, especially as it relates to food. While pharmacies still remain open, I know many are troubled by the fact that they cannot go to the supermarket as they would like. I would like to remind the general public that food services, we've been talking for several weeks about preparing for a 2-week period. The 2-week period is here. If you have not been able to because you were not paid on time, etc., fill in the social assessment form and we will get food to you as soon as possible. Also, you can call if it's an emergency and we can see what can be done. But in all essence, it is the movement of persons that we were attempting to restrict over the past 3 weeks. We're seeing that even with every stricter measure, people are finding ways to still move around. And the places where there's excessive movement, one of them is the supermarket. So we're doing everything within our reach and in collaboration with the supermarkets to ensure that everyone is getting the necessary food supply to be able to survive the 2 weeks.
Thank you, Prime Minister. We have one more question from Steven Cyrilin of PJ82 Radio. It is reported that the military plane has departed from the Netherlands with the medical supplies, among other essential items. Can you please provide some more information?
Yes, I believe Fana already elucidated to that in answering the last question, but we were supposed to end this press briefing by 1:45 so that we could meet the plane. We are already late, but the plane has landed. It has come with the necessary IC beds with everything attached to it, including the equipment that is necessary to monitor the IC patient medication, as was mentioned by Fena, our public health and ESF coordinator for number 6. Everything required, the personnel will arrive on the 7th and 8th. The logistics required to plan and prepare are in place. The location for the hospitainer, which would house the 6 beds, will be on the tennis courts at the Raoul Lillage Sports Complex. So next to not next to, but in close vicinity to the pavilion and opposite of the hospital. And the hospital also has had a tour today and seen that they have expanded their capacity even within the hospital to be able to deal. They have literally a COVID wing within the hospital and a location to check on patients who come in as suspected COVID patients as well, just outside the hospital in a covered area that they can get them into the hospital should that be required. So yes, I do have some closing remarks, and then that will be it for today.
At this time, I would like to inform that the floor is closed. I would like to thank the members of the media for submitting their questions. Prime Minister, you have the floor.
Thank you, Ms. Roach. I would like to thank, first of all, our colleagues on the French side, Madame la Préfète, the collectivité of French St. Martin, including President Gibbs and First Vice President Valerie Damaso. I would like to thank also our connections in the health field, as well as Commando Basso and his team where it pertains to public order. We have been collaborating and cooperating on a high level over the past few weeks and meeting on a weekly basis, but also communicating on a daily basis to ensure that we are doing the right things together. Any persons requiring a waiver who have to be on the road for urgent reasons, and that must be able to be demonstrated, whether it's for medical care or for family movement, they must send their form to PR@policesxm.sx for the approval from Chief John. If anyone is in a labor dispute, send an email to dismissalteam@stmartingov.org, and this is also available on the website. For social services, so if you have a need that relates to social services that is not related to the social impact form, it is info@stmartingov.org. All of this information will be put out in special bulletins as I'm finished, so that you don't have to try and write what I'm saying. But follow 1079 FM as well as government website and government Facebook page for information that is on time and up to date. I would like to ask the people of St. Martin, as I close my remarks for today, to take this time of quarantine with your family to get to know them better, to share experiences, to talk, to laugh, to play, to worship. We have just entered the Holy Week, and I know many would have been going to novena services and early morning services. Do your devotions together. Assist your children with their schoolwork if they are still able to receive such from the schools. If not, there are so many websites online that the Education Ministry will also post again for parents who need extra activities to do with their children. Arts and crafts are still handy. We are recycling, so use recyclables to create fun projects with your children. You can find lots of things to do online, but whatever you do, stay off the roads. Stay off the roads unless this is an emergency, as mentioned before. Anyone who uses a public place during an emergency is obliged to stay at least 1.5 to 2 meters away from others in their vicinity. Social distancing will be strictly enforced and implemented. The police now also have the right to fine you for not being properly socially distanced. The Emergency Operations Center will continue to assess, and execute the plans to suppress the spread of COVID-19 virus. The key stakeholders are public health, CPS, the police department, and all the justice chain, as well as ESF 10 and 9, 10 being all related to the harbor, the airport, businesses, and 9 being government services. I would like to also ESF 2, BTP is and ESF 1, GEBE, TELEM, UTS. All these services will continue, and therefore I am asking all of the heads of these services to ensure that you have the necessary waivers for your staff that need to come out, especially security officers as well. We would like to ask everyone to maintain your quarantine at home. This is for the good of the country. This is for each and every one of us, for your good. And please, if you have an emergency, call 911 or call 912 for the ambulance. Do not stay at home sick because of the curfew. Inform the necessary services, and you will be assisted as soon as possible. I want to thank you for your compliance thus far. You are the backbone of St. Martin. Swaliga, St. Martin Strong, Uwalichi, Land of Strong Women. Women, take control of your households. Keep your children inside, especially the teenage ones who still congregate outside, because that is a jeopardy we face in the spread of COVID-19, this pandemic. I thank you for your attention today and every day, and I wish everyone to remain safe, blessed, and we ask God to protect the people of St. Martin, Saint-Martin.
Honorable Prime Minister, EOC panelists, radio listeners, and online viewers, this brings us to the end of this broadcast for today, Sunday, April 5th, 2020. For rebroadcast, tune in to St. Martin Cable TV, via St. Martin Gov Radio 107.9 FM, and via the official Facebook page of the Government of St. Martin. For video on demand, log on to the official government's website at stmartingov.org. On behalf of the Department of Communication and the Government of St. Martin, I'm Rolika Roach, and bidding you a pleasant Sunday further.